All right, Medicine Revisited. Now I want to make clear, just so you know, in the very beginning of this lesson, this is not a medicine bashing lesson. The goal is that we can look at the system and look at the people and providers that are out there and that are in front of us right now, and that we can objectively look at the services they can provide us, and we can choose. So I just want to get that very, very clear in the beginning. We just want to call stuff as we see it and make sure we come out of here with a very, very clear understanding of the environment around us. Does that work? Okay. So understanding how integrating conventional medicine and alternative medicine is best for your long-term health. Many of you have probably heard of Andrew Weil. He's one of what we would call the fathers of complementary medicine in this country. He started really the first university program for integrative medicine at the University of Arizona, which graduates a lot of more natural and holistic practitioners, more than any other school in the country. So Andrew Weil says, the power to heal is your property and birthright, ready to go to work whenever changing conditions create a demand for it. One of the things we want to make sure that we are paying attention to is the changing conditions that are around us. Because the issue is, one of the big problems is we're not paying attention to how things are changing as fast as they're changing. And we're not adapting to them and changing the way that we seek care or changing the way that we're patients. All right? So we want to make sure that we kind of update that today and evaluate any beliefs that we have about the medical system or about alternative providers or about what it is to be a patient and get those current so that we can start making better decisions right away. Okay? So holistic medicine. Holistic medicine is based on the premise that the body was created with the knowledge of how to maintain and repair itself, given the right tools, resources, and environment that supports progress in healing. Okay? Holistic medicine or a holistic medicine practitioner is usually going to be looking to support the body through a healing process, not to dictate healing within a body. Okay, and we'll allude to what types of treatments are more dictator-like a little bit later. So holistic medicine respects the created innate ability that the body has to heal. Let's take a look at what we call CAM, or what is known as CAM, which is Complementary and Alternative Medicine. All right? So the National Center for Complementary and Alternative Medicine of the U.S. National Institutes of Health has classified CAM into 5 main areas. Alternative medical systems is one. This would be known as Chinese medicine or naturopathy, if you've seen the ND behind names. Right now in this state, we've got a big push right now for naturopathic doctors to become licensed and can officially practice. There's a lot of states where it's legal. Here it's not yet. So that would be considered as an alternative system. All right? Secondly, mind-body therapies. This would be known as psychotherapy, emotional freedom technique, those types of things. Okay? You can go out and research these things right on the NIH website. If you search CAM, it'll come up. It's a taxpayer-funded branch of the Institutes of Health. Okay, this is being studied. There's tons of research out there, and most of us really just don't know about it because it's not mainstream. It's time for us to know that these things exist. Okay? Biologically based therapies. So biochemical or biologically based therapies would be herbs and food supplements. So they make that as another category within the complementary and alternative medicine world. Manipulative therapies, which would be chiropractic, osteopathy. Everyone heard of a DO? Osteopathic physicians are now accepted just like MDs, just like medical doctors. They can do family medicine. They prescribe. They have all the same rights. It didn't always used to be like that. You guys know that? DOs fought for years and years and years to get respect from the community, and the problem is they fought so darn hard they became a part of it. and they got sucked right into it, and they became just like them. Now, some of you may know DOs that still manipulate, that can still adjust, that still do physical medicine work. Those types of DOs you want to seek out, and if you can get to them, you want to grab onto them, and you want people like that in your profession, in your health professional world. But it's becoming more and more rare for osteopathic physicians to be around that actually are more holistically minded. Another manipulative therapies would be physical therapy or massage therapy. Okay? And then the fifth category is what they call energy therapies, which would be classified as acupuncture, biofeedback, those types of things. Again, if some of these things you've never heard of or you weren't familiar with, you should go and research them, because these are official therapies that are recognized by the National Institutes of Health, that are going on and have been going on for centuries all across the world. It's only in the United States that people don't know these things exist and that they're readily available. Things like acupuncture are now becoming more available, but to find a homeopathy practitioner, very difficult in the U.S. In Europe, homeopathy is what the medical doctors use. So things are different here. It's important for us to know the differences. So alternative medicine is to be understood as therapies that are used instead of conventional medicine. That would be an alternative. Complementary medicine is known as the utilization of alternative medicine alongside conventional medicine. It's also known as integrative. So the difference here is there are some alternative practitioners that will never, ever, ever work with the conventional world. They're light years apart in what they believe. They don't respect each other. They both bash each other. Both of them, each of them look at each other and say they're quacks, which you've all seen. There's this data and all of it conflicts. That's the alternative medical world. The complementary medicine world are people who practice alternative therapies and help people implement alternative therapies while they are also seeking conventional medicine. Using the blend. A good example of this would be the mounting amount of research around homeopathy and working together with chemotherapy. Now, I personally am not a strong advocate of chemotherapy. It's one of the reasons, as you know, my mom died of cancer when I was very, very young, so the world of cancer is something that I've done an awful lot of research in. Not a huge fan of chemotherapy. However, they're finding out now that when using in conjunction with homeopathy, you can reduce a lot of the damage that the treatment of chemotherapy does inside the body. So they're finding that these alternative medical techniques can actually support the body through healing even when you're pumping poison into your bloodstream. It's kind of nice to know. If they can do it with the treatment there, think of what they could do without the treatment there at all. So you need to realize that there's two different ways of looking at it. There's alternative, which means it's the side that it's kind of the far left side. And then you've got the complementary or the integrative. And you probably want to look for the people and the providers who are more integratively minded, because it's going to be an easier transition for you to bring in health practitioners who don't absolutely hate your other doctors. And vice versa. We'll talk about the other direction as well. All right? So conventional medicine is focused on the treatment of disease once it's already present. Does anyone have a problem with that statement? Again, we want to call it what it is. Conventional medicine in the United States of America is 100% reactive. So this conventional method of healthcare is commonly being referred to as sick care due to its focus on disease opposed to health. Again, completely objective, but we need to call it what it is. If all they're going to do is see you when you're sick, we need to call it sick care because they're not taking care of your health. And it doesn't sound so fun or nice when it's called sick care, does it? When we actually call it what it is, and define it as what it is, it's not as glamorous. Maybe it'll change the way we start to think about it when we call it what it is. Conventional medicine is focused on controlling or managing symptoms of a disease process with drugs or removal or manipulation of body organs and tissues. We can all understand that. When we go to the doctor, we get a lab test. They read the biochemical makeup of your blood. They see if something's off, which means a disease is present already. And then it's either a chemical or it's a referral to a specialist, and now you're talking surgery. Or it's, I don't know. So they have certain tools, and we'll talk about what tools they do have later and why you would want to use those tools. So this graphic kind of gives us a little bit of an understanding about how conventional medicine works. We have the cause there, which is our lifestyle. Remember how much percent of disease is preventable through lifestyle and environment? 98%. Again, when we define genetic for what it really is, and we look at it objectively, about 98% of disease that we experience on this planet right now is preventable. So we have these lifestyle factors on the outside, and conventional medicine just simply doesn't talk about these. So we need to make sure that we're becoming cause-focused, not symptom-focused. If you're using your symptoms as reading them as a sign and using those to get to a cause, that's one thing. But if you have a symptom pop up and your first knee-jerk reaction is to cover up the symptom and not worry about the cause, that's when the problem occurs. That's when your health becomes compromised. Okay? So CAM is focused on the treatment of the entire person. Body, mental, environment, spirit, etc. Not normally focusing on the disease or symptom itself. I want to pause for just a second and make sure that before I go any further, that we acknowledge something. A CAM provider or a complementary and alternative medical provider isn't always the best thing since unsliced bread. I like unsliced bread a lot better than sliced bread. Because some of the CAM providers out there are just as reactive as the conventional medical system is. And they just say that they're using more natural treatments, but they're not preventing anything from happening. They're just as reactive as everyone else. So we need to make sure that we can identify if that's the type of CAM provider you're looking for, or if you're looking for one that can be more preventive for you. Okay? So CAM seeks to utilize symptoms as signals from the body to point them towards the true cause of the disease. And normally a complementary or alternative medical process or procedure or therapy supports the body through healing and does not squash symptoms. Because I don't know about you guys, but most of the time when you put your health goals down on paper, they aren't to, I hope I get disease, and then I can find someone to help me try to get rid of it or at least get rid of the symptoms. How many people wrote that down on their goals when they started this class? I would really like to get disease, and I hope that I can find someone who can help me once I get it. Obviously not. So the primary purpose for Lesson 11 is to help you begin to understand the vast number of options that are available when seeking out a health professional and help you redefine what it is to be a patient. Okay? So how do you define health and disease? This is important. Pay attention and start to think where your belief system is right now, because you may need an adjustment in your beliefs and your thought process around this. It's a possibility. Your definition of these is driving the decisions you make and the health you're experiencing today. If you have health problems in your life, you need to listen here. Because the way you think and make decisions and the type of care you seek out is based on what your beliefs are. We may need to change some beliefs today, because if you're experiencing disease in your life or symptoms that you don't want there, it's usually tied to a belief and a behavior. All right, so what is health? Health would be without symptoms and its self-sustaining vitality. Remember that graph we looked at in lesson 1? That had, over here we had symptoms and disease, and it was red, and then it moved towards the middle, and that was with no symptoms. And then there was this whole other side it got green, and that was thriving, that was vitality. When we're talking about health, we're not living in the middle in that vacuum where we just don't have symptoms, but we're just hoping that we don't get something, we don't catch something, or something doesn't happen to us. Self-sustained vitality, I believe, is what everyone here is looking for, ideally. We do not want to just live in a vacuum of being without symptoms. We always want to be moving towards how can we maximize how we're feeling. Definition of disease for most people is they feel they have a broken body or their body is in need of tools, resources, and support. If your health situation right now is being managed by a pharmaceutical agent that you don't see an end to, you are not in the healthy category. And it's important that you start to be honest with yourself about this. Because, I told this story in the first lesson too, is I've sat down in front of many patients in consults, and they told me how their drugs were keeping them healthy. How their blood pressure medication was keeping their blood pressure down. Their cholesterol medication was keeping their cholesterol down. Ladies and gentlemen, if you need something outside of your own body, that isn't health. That is disease. And we need to call it what it is. And if you want health in your life, then you need to get into a position where you're not dependent on a drug every day to keep a level down. How many people here believe their body can keep that level down if it's given the right tools and resources? Yes. If you haven't learned that up to this point, I've done a terrible job teaching. You should know that by now. You should believe that by now. You shouldn't just know it, you should believe it.